Welcome, Carolyn, and thank you so much for joining me. I'm
Thank
sorry,
you for having me.
of course. I'm sorry to all my viewers for the Facebook. I think we've been having some issues, technical difficulties, but I'm recording the session on Zoom here where I'm with Carolyn, and hopefully you'll be able to watch this later once I post it. So I'll do a little introduction about Carolyn. Carolyn Rolen started her nursing career as a hospital corpsman in the U.S. Navy. She's now an oncology nurse navigator at Honor Health in Gilbert and has been specializing in oncology for over 10 years as an inpatient nurse, outpatient infusion nurse. Her main role as a nurse is educating patients from day one on diagnosis through their journey for either chemo, radiation, oral chemo, surgical oncology treatments, and survivorship. She specializes in educating patients on how to stay safe from infections or contracting contagious diseases. So she's the perfect person to talk to today regarding the pandemic that we are going through right now with the COVID-19. Welcome, Carolyn. Thank you so much for doing this with me. And also, I would like to thank you for your service and for everything that you do. Carolyn was my chemo nurse while I was going through my treatments, and she took care of me so amazingly. And I think that was the one reason that I was able to get through it, was just to have you by my side. So thank you so much, Carolyn.
It was an honor to be on your journey.
It was amazing.
It's not easy what you guys go through, and if I can make it any easier, that's my mission.
You definitely did do that. So Carolyn, I want to just start by asking you about, there's so much of information that we're being bombarded with right now with the social media, with, White House briefing, with news about the coronavirus. And there's just so much information that we've been thrown to us. So my first question to you is, what is it that we can do as a cancer patient? Because already our, the immune system of somebody who's going through the treatment right now is already shut down. So of course, you do give precautions that need to be taken for anyone going through chemo. What is it that extra that needs to be done at a time like this? What would you suggest for someone who is right now going through the chemo treatment or radiation or anything whose immune system is shut down?
Well, the good thing is, our cancer patient has an edge on everybody else because they've been taught to, stay away from crowds, wash hands. Their immune system is down. Chemotherapy is not just killing the cancer, it's killing our good cells. So our good red blood cells, our white blood cells, they're always down during chemo treatment. The biggest thing is just isolation, staying away. A lot of things, people are like, yeah, we still have to go to the grocery store, but you don't know who touched that box before you touched it. I just think that a lot of things are spread that way, and we really need to have contact precautions. As a patient who is going through treatment would usually stay home and the caregiver would go and get the groceries, right? You guys really never left the house.
No.
And so that's what my main goal in education is for everyone, not just our patients, but everybody, to take those extra precautions. This coronavirus, I thought was not as serious in the beginning. I'm talking about a month ago. I didn't know what to think, and now it's scary, and it's scary for those patients who are in treatment. The biggest risk patients, are blood cancer patients, our lymphomas, leukemia, and myeloma. That cancer attacks those white blood cells. When those white blood cells go down, we don't have, the person does not have an immune system anymore. They have nothing to fight off anything. So, my biggest high risk are my blood cancer patients, also bone marrow transplant patients, and patients in active treatment, chemo, infusion, as well as oral chemo. The patient might not need to come in, but they're on oral chemo, and the chemo is doing the same thing, bringing those counts down.
Yeah. Like apart from the usual precautions that one is supposed to take, like, wear a mask, obviously, stay isolated. What you suggest, that is there anything extra that they need to do at this point in time?
As
Or
a patient,
yes, or is it still the
yeah.
same guidelines that we still have to just follow?
Yeah, we've always taught that for our patients, whether there was any viruses or flu season or anything. It's always, pretty much quarantine yourself to the home. Don't go into Walmart, don't go into the churches. No shaking hands, and just protecting yourself.
Right. So
And
this.
of course,
Sorry, go ahead.
they were talking about, they go back and forth about wearing a mask. Oh, well, you don't need to wear a mask if you're not coughing, or you don't need, no. If you're going out anywhere in public, you should wear a mask. The biggest concern, go ahead.
The biggest concern, I think, is also what type of mask, because when I was going through chemo, of course, and there was no, coronavirus, we were okay with just wearing the regular mask that we're given. But, we have to wear the N95 mask, or
No.
like, we don't have to.
Mm-mm.
So
no.
it's okay to just
be wearing regular,
okay.
Wearing those regular masks. And we're running low, so there's some people offering to make some, with
The fabric.
the fabric, and which is great because you can wash them. Once you wear them, you need to wash them when you're out in public, or throw the ones away. You just can't keep wearing the same one, because there was any particles on the outside of the mask and then you go to touch it to take it off, you better be washing your hands. Don't take it and put it back on. So having, a couple masks at home if you were to go out. But honestly, Priya, we need to stay home. If we could just lock everybody up for 2 weeks and let this thing die down, it's just really sad how fast it is spreading. The biggest concern I have for patients, and this was even prior to the coronavirus, is the caregivers. Yes. Where are the caregivers out?
Absolutely.
We have a lot of young patients who have those 18 to 25-year-old kids still living at home. Where do they just go? Are they hanging out with their friends? And then bringing whatever home back to the patients with, immunodeficiencies. That is my biggest concern.
Well, what should caregivers be doing to make sure that they are not the ones? Obviously, they're the ones who are going out. They're the ones who are going grocery shopping, who are running errands for, the patients. So what extra measures can they take to ensure that they're not bringing anything, back to, the patients at home? So what would you recommend?
I think picking one designated person to go,
Right.
And just so one person's leaving the house per day, not everybody's out and then coming back. Mike went out today. Mike went out to go get some gas. He also had to go to the grocery store. I suggest him wearing a mask. And when he got gas, I gave him gloves to wear, disposable gloves. I mean, you don't know who touched what last. And it is definitely contact precautions. When I worked inpatient, we gown and glove up right before we went into the patient's room. Before we left the patient's room, everything came off. And of course, always wash your hands. As soon as he came home, I was like, go wash your hands. And that's just the automatic. Don't touch anything. Have Clorox wipes right there by the doorknobs. Of course, he has to open the door. Just taking those precautions, knowing that everything that you touch can potentially somebody else can touch that and
Absolutely.
pass it.
So would you recommend any additional precautions for cancer patients who maybe just got done with chemo, or who are at least in remission, 1 to 2 years out from their treatments, like someone like me who's now 2 years out of treatment? Obviously we are trying to be isolated and do all the measures that are being suggested, but is there anything in particular that we need to be careful about? Like, is our immune system still shot, or are we up there where our body's now able to fight something like a common cold?
Mm-hmm.
Is this
So
something
I got a couple of phone calls.
Yeah.
I got a couple of phone calls this week in the office of our patients who've been been out of treatment for 6 months, a year, 2 years, and they called and they said, "Carolyn, what's going on? What do I need to do? Is my immune system okay?" If you have gotten your labs recently, you're looking at those white blood cells, and I'm sure after being in treatment and being able to recover 2 to 3 months out of treatment, your immune system is back up. But I would give the same precautions, whether your immune system is down or not. This is a highly contagious virus. To still take those precautions. And one of the doctors told me it really stuck. And he said, "I wish everybody would act like they do have the virus and take those precautions.
Yeah.
You have the virus, stay home. You not want to spread it to anybody else. Wash your hands. Wash. 20 seconds. Soap and water is the best thing for your hands. They talk about hand sanitizer. If I can, I'm washing my hands.
Right.
I really don't trust hand sanitizer. So,
yeah, absolutely. So, Carolyn, so there's now a new stigma around the coughing and sneezing, right? So before we wouldn't make a big deal of it, but now when we are even out at the grocery store or wherever, you hear somebody cough and sneeze, and the first thing that goes through our mind is, "Oh my gosh, is this the corona?" Right?
mm-hmm.
So at what point should someone be concerned that they need to go in, even if they have a low-grade fever, especially someone who's going through cancer, or the treatments right now? At what point should they be concerned that they need to now make that phone call and go in because they were exposed, or they do have the scratchy throat and the low-grade fever, which is actually also normal, right? Because whenever you used to send me home, you'd always say, "Priya, call me if you feel like you have a fever." So at what point are we going to differentiate? What point are patients going to differentiate that, this is just a chemo side effect versus, something that's going around?
Yeah, right now I would take everything seriously. If you have that fever, we're going to be sending you to the ER. The ER is right now doing triage. I think they've got something, I'm sure they're set up. But if a patient calls me and they have a fever, I'm going to be sending them to the ER. We don't want to wait. It could just be a cold. Mostly a patient would have neutropenia fever because they do have an infection. Hopefully it's not the coronavirus, but we would definitely send you to the ER. Before, we would listen to your symptoms, maybe give you an antibiotic and see how that goes, talk to you the next day. I don't think they're taking those risks right now, especially with our cancer patients. Their immune system is very low, and this is spreading very fast.
So is it the fever that would be the key for you? As long as they don't have a fever, they really don't have to worry about it. But it is the fever that would be the one to
right. And right now, like, I was hiking. I came home and I sneezed like 3 times, and because I was outside, I have allergies. Everything's blooming. And I even said, I hope I don't sneeze like that on camera here, blow everybody away.
Right.
But it's taken those, yeah, this is allergies or what is this? But I think our main indicator is that fever. Um, you know, and that's what they're talking about as well. Fever, cough, and shortness of breath.
Okay.
So
Those are
if you've never been short of breath before, we have a lot of patients who are in treatment for lung cancer or head and neck, and they have some extra secretions or they are short of breath. So that's hard. So they automatically have that. So then I would definitely look for that fever.
Okay. So another question is, the healthcare system is obviously changing, right now dramatically and rapidly, just to because of everything that's obviously going on. What specific changes have you made at work, or do you foresee coming to address this issue, especially in the cancer world?
So, right now we are doing treatment patients only. We have extended all our follow-ups right now as in 2 weeks. And our treatment patients who needs chemo are the only patients that are being seen right now. They are minimizing the amount of people going into work. I got my wonderful desk set up because this week I will be starting to work from home and doing telehealth and doing education and talking to people and triaging them over the phone instead of being there at work. So they're minimizing the people that come into the clinic, and but not stopping any treatments.
Okay, so obviously the treatments that are going on have to continue. What about for somebody who is maybe just going to start a treatment? What are you telling them? Should they start it or should they wait? Like how are you handling that situation?
It's mostly coming down from the doctor. With the scans and the tests and the new diagnosis, we know that if it's more aggressive cancer, we need to start now. And my doc's really good at figuring that one out. So, and then it's also up to the patient. He lets the patient know, gives them all the info they need to know, and then lets them also decide what they want to. I have a patient that's going to start oral chemo treatment. So she doesn't have to come into the clinic. I did her chemo teach last week, and she called me up Friday and she says, Carolyn, do you think I should really start this? Should I wait 2 weeks? And again, I give the same education.
Right.
And it's, you need to isolate yourself. I would start treatment. If that was me, I would definitely start treatment. But I would stay home. And then she said, well, I have 2 sons living at home, 20 and 24, and they're going to go out or do. And so we had a lot of education about that, that she could do everything she can to protect herself and stay home and limit that one person who's going to go to the store and do those things, and make sure they're taking all those precautions, contact precautions. But, you have the young ones out there, and it's hard, they have to stay home, no socialization, everything has to be via phone. And so it's doing a lot of education for those caregivers. So starting new treatment is up to the doc. How aggressive is that cancer? We do have some patients who also have, they're elderly themselves, and they might be taking care of I had this happen, 100-year-old father who's at home. Yeah. Both patients are immunocompromised, and they decided, we're going to wait 2 more weeks, see if this thing settles down. We don't want to do this right now. And so, talking to doc and getting that permission, and that was okay. So we delayed their treatment.
Sure. Yeah. And, one of my main things right now is, I don't think people understand what self-distancing really means. Mm-hmm. The other day I was walking to the grocery store just around my neighborhood, and the manicure pedicure place was filled up with people, and I was just amazed at that. People are really not taking the self-distancing seriously, So rather than me, a person who's not really a doctor or a medical background, I want you to please tell our viewers, like, what is self-distancing really about? What are the precautions that they need to take? Like, let's define it for them in easy terms, because I think people are not realizing how scary and how fast this is spreading.
Mm-hmm.
And why are they being asked to do to be self quarantine? Like, what is it going to do
Right.
for everyone?
Social distancing is where it's at, and stay home, stay home, stay home. As a family today, we went for a hike. We gave the kids a talk and said, we don't go up to anybody. We're staying 9 feet away. If somebody's coming off the trail, we're going to go off to the side and wait for them to pass. And we did that. There was a question whether the boys can play with their friends at the park and play some baseball. And I said, I don't think that's a great idea. I said, well, they won't be close to each other. They'll just be throwing the ball. I said, but they touched the ball and they're going to be touching the ball.
Yeah.
So, social distancing is go to the store, get what you need, decontaminate, and come home. Stay home. And it's not, social distancing is not just for cancer patients, it's for everybody.
Absolutely.
And who we're protecting is the immunocompromised, the elderly, and people with underlying health conditions. But yes, getting a manicure and pedicure, I was like, oh, what am I going to do about my nails? And Mike's like, well, I can learn to do those. And I was like, okay.
Yeah.
See how that goes.
I look forward to seeing what our nails and our haircuts and hair colors are going to be like at the end of this quarantine. We may all look very different when we see each other again.
I think the all natural look's going to come back in style.
Right. Absolutely.
But definitely, I mean, I just wish everybody could just stay in their family unit. We haven't even seen grandparents. My parents are still in New York. Really worried about New York. It's the numbers keep going up every day. Yeah. The Comfort is coming into New York, so I served on the Comfort. So I wish I could go and do a missions trip over there. But we haven't even seen the grandparents here. No friends. My son's in the Marine. He's in California. My other son and his family is in Gilbert. And my daughter is in Gilbert as well. Well, Mesa. So I even had to tell my daughter the other day not to come over because, I don't know where she was with a friend. And, it's just taking those extra precautions.
Absolutely. One thing that you had said, Carolyn, when we talked earlier was, and I feel like you should probably talk about this, is when a caregiver or somebody, we go to the store and, we pick up maybe bread or something. Now that wrapper, what the bread is wrapped in, has passed through so many hands, right? Mm-hmm. So obviously, like, these are the things now we have to really pay attention to, right? So what do you suggest for stuff like that? And it's not only for cancer patients, of course, it's also for us, because at the end of the day, people who are stocking the shelves, or where that, loaf of bread came from, who touched it, all the steps it goes through to reach the shelf, and then we are bringing it home. At the end of the day, we're still being exposed.
Right. So I keep those Clorox wipes in the garage by the door there. So we just wipe down the plastics with the Clorox wipes. And I was talking to my dad, and he said right now they'll go to the store and then they'll leave their stuff on their closed-in patio because it's still cold in New York, and so that would kill any germs. But here in Arizona, it's still warm, and so I just wipe everything down. And of course, always wash your vegetables like you did before. fruits and vegetables. And that's, like I said, you never know who touched what before. Somebody could have been in the store coughing in their hands. They grabbed a box and they're on the phone and they're like, oh, we don't need that. And they put that back and guess who's touching it next? So it's crazy right now. It really makes you stop and think how contagious this is and being around it. And that's why I say wear a mask. I know you go to the store and probably 2% of people are wearing a mask and you're looking at them like, are they sick? But they talked about somebody being on a bus, still being 6 feet away from each other and still contracting the coronavirus. And even though they weren't in close proximity, there was one person who had a mask and they did not get the coronavirus. So, we talk about contact precaution and droplets because, when you walk in a bus, they might touch the seat or, another person will touch the seat. Yeah. So it's, you just really have to be aware of what you're touching and what you're bringing back into the home and stay home unless you're going as a family to the park or, and not a park that has like a jungle gym, let your kids play on the jungle gym, going for a walk and keeping that social distance away. I wrote some things down. I just want to make sure I hit everything. I do also want to say there is a website and it's a home, and I know it's probably closed. You know the home I'm talking about, cancersupportcommunity.org. There's some great info on there for our patients, and then also for everybody else. But they have really good info. I looked at that today, and I was happy to see that they're sharing that info. So cancersupportcommunity.org.
Okay, I'll put it on the post when I put this video out. That way people can have access to it. And then, there's one very important question that I think everyone has on their mind, and I really would like your opinion on it. How much toilet paper must we buy in stock?
So we didn't buy any toilet paper. We're using washcloths. No, I'm just kidding. But if we have to, we will. I don't understand the toilet paper thing. I never understood it. And I thought, well, is it because it's being manufactured by people who have the coronavirus? Or what's going on with this? We still do have toilet paper because I'm a Sam's shopper. So I always have things stocked up.
Right.
But I have not seen any on the shelf in the past 2 weeks. So when that runs out, and if it happens, then we have a lot of washcloths, and then we'll just throw them in to the laundry and use them. We do the same thing with paper towels now. We even made that rule in the home. We have dish towels, and we'll use the dish towels to wipe our hands, and then we just put them in the laundry. So laundry every day. Make sure you take your shoes off. Don't walk around the house with your shoes.
Absolutely. My husband and I always talk about this. It's like, what is the thing with the toilet paper? And we feel like maybe some people just went on and started buying it, and it became a domino effect that people were wondering, why are they buying toilet paper? Maybe I should go buy it. And then it just followed. I don't feel there's a need to be stocking up on toilet paper, but
and I think we're winning. Arizona is the #1 buyer of toilet paper, so we're definitely winning. I don't understand the toilet paper, but
if that's
I was even looking for baby wipes for my grandson, and he's there's no baby wipes. So
absolutely, I totally agree.
Maybe people are saving those to wash themselves with just in case we run out of water.
Right. So my sister-in-law has some comments here. She says they're doing Zoom happy hour dates with their friends. And actually my husband and I have been doing that too, with some of our friends, and keeping Lysol wipes in the garage and gloves, in the car. I think you just have to keep everything handy and just, I
Mhm.
feel like, you know, this whole wave of cleanliness, it's going to become a habit for everybody that going forward, I don't think it'll be easy to let go of it, which is actually a good thing. So I'm hoping in the future, you know, everyone will fall sick less because these hygiene habits are going to be formed, and it's just going to be natural to go wash your hands and use the sanitizer as much as possible.
I do want to add something to the toilet paper thing.
Sure.
So Mike said, I don't know why we can't get toilet paper, but because of that, I'm going to buy a bidet. So he bought a toilet seat with a bidet. He ordered it off of Lowe's because they were all sold out. I said, are we the only people that bought a bidet? So no, we're not. So everybody's buying bidet. And then I was thinking, but don't you have to dry yourself after that?
Yes, you still need toilet paper.
but the one he has is it's heated and it has like a blow dryer or something on it. So
wow.
I'll do a video. Not of me sitting on the seat, of course, but of so really excited to try this bidet situation. We don't need toilet paper anymore.
Absolutely. At some point we'll probably not need it anymore.
Was the toilet paper business out?
Yep. Well, thank you so much, Carolyn. And I'm sorry about the technical difficulties earlier on. I will share this on Facebook. Is there anything else you would like to add to before we end this?
I think what I do want to say is, you know, I am a healthcare professional. I am a nurse, but I am not your doctor. I'm not your oncologist. I'm not your PCP. And so you do want to have that communication open with your doctor and making the best decisions with your health team. I did want to say that symptoms, we're looking for fever, cough, shortness of breath. Fever, number one. And social distancing. Stay home.
Absolutely.
Stay home. Like you said, you know, Zoom happy hour, and that's another thing. And most of the world right now is going through what cancer patients went through, that isolation and not having their life being taken away, you know, and sitting at home. And so if we can use Zoom or FaceTime and interactive activities over the internet, or, you know, using those electronics, because we need that for our mental health, you know. Yeah. So staying in touch is huge. So
absolutely. I think you just solved a problem of mine that I've been having. I don't know why I kept thinking about my chemo days, but it makes sense. It's because I was stuck at home at that point and I wasn't going anywhere. Mm-hmm. And that's why it keeps coming back to me, and I feel I'm feeling the anxiety, and so I think that's exactly what it is for me, is that I was isolated at the time, and that's why I'm feeling that way right now. Yes.
Stay home, everybody. Stay home.
Stay home for sure.
Don't get your pedi or manicures. Make your husbands do it.
This is the time to test them out for sure.
I know.
Well, thank you so much, Carolyn.
Thanks, Priya. Appreciate it, and I appreciate you.
And I appreciate you. Thank you so much. Love you. Thank you, everybody.
Yes. If anybody has any questions, you can always message me on Facebook as well. Okay.
I'll tag.
Thanks, Priya.
Thanks. Bye-bye.
Bye.